Right, well, I'm Tony, and I made a dental app for my patients about 8 years ago, and clearly I no longer work. And this is as far as I've got. And you've got this because you registered at some stage for the app. So please pass this on. And this is what I'm trying to develop at the moment, which is an oral health service just based around prevention. And we can do this. And I've made this. But clearly I've had a bit of help. But not from you, I've had it from AI. And it seems to remember what I do. So these are my contact details. And we use QR codes and we use bots. Now, the reason I was doing this today is there was a chap that I saw back in about that time, and he had the idea that he had three hygienists and himself, and he worked 3 days a week. And this basically are his ideas. I haven't read the book. I've only just got it today. I couldn't remember. I just had a rough idea of who he was. So from the wonder of them in ChatGPT, it figured it out. So what I have done, this is during COVID, I'd made this website about prevention and minimal invasive dentistry. But the video you can see there, I'll repeat at the end. And it also says about my dental history. So anyway, this is what I've kind of also made, is a learning place. And what I want people to do is to start your own business. There's no reason that you shouldn't. As FDs, I think you get scared into starting your own business. But if we end up with just a few corporates, which is what will happen, we'll see less and less people for more and more money. And that isn't a good thing. Look what's happened to the vets. Oh, and if you want to know about me, I've written a lot, made a load of videos about my career. And yeah, I've made it into a book over the weekend. So have a look at that because I've used a bot. And I've always been interested in prevention. So I grew up in Anglesey. So I made this video using something called Doodly, which is sort of not AI, but it was pretty clever at the time. It probably took me about 8 hours to make, but it's still relevant. But now what you can do is the videos that I have made, bearing in mind I'm terrible at writing, we found lots of grammatical and spelling errors, but it takes these videos and it makes them into into a video, an audio. It's not, you can't hear me talking, and also you can ask the bot questions. So this works really well, and what we're trying to do is to get people to take trustworthy advice, which they will get from you. But you don't have to make these. We can make them, and we can improve them gradually using these LLMs. And so one of the LLMs is you can use it for business. So if something's incorrect or needs updating, we can just feed it into this resource. And yeah, I thought that would last longer. Anyway, I don't know if we go back. There we are. That was quick. Anyway, we can do this sort of thing. And if we collaborate ourselves, we can use this AI to help one another. Because what we have at the moment, the health service, whichever way you look at it, isn't working. And this is what on the one on the right is what they use for startup companies and Facebook and Twitter and all that kind of malarkey. I mean, what happened to them? They don't make any money. But anyway, we can help one another to develop something. And these are some of the things that I've been using. So the top video, I heard this woman talk on a webinar, and I'm happy to do webinars, but just record them. 18 months ago, and I went to see her for the second time in the States earlier this year. And I'm going to listen to this chap talk tonight, Paul Glassman. And so a lot of the ideas on my website are actually with regard to him, because he's talking the same about how we can promote prevention more and use some different materials. As we got there on my website, Decay Away, and I've got lots of videos on YouTube. And this is what I have on YouTube. If you just do Teeth4Life, there are lots of, I've been doing this for a long time. My first video was I sent to the corporate I'd sold my practice to, because they wouldn't answer my letters. And you realise the power of videos when that happens. So anyway, currently this is what I haven't got an app. They're too expensive to build, but I've built this website. So everything on the website I've done. And what I need you to do is basically to register for free, and also to sign the document here to help improve access. So then if you register, then you'll appear on the map. So you can see there aren't many of us on the map, but anyone can sign on it for free. So yeah, have a look at that. Please sign up. And then as you put your email in, then I'll be able to contact you and we'll be able to contact one another. Oh yeah, put yourself on the map for free. And then if you sign the petition, then we're more likely to change this slightly out of date dental act, where we'll be able to apply silver diamine fluoride and hopefully help the elderly suffer less from aspirational pneumonias, all manner of things. And so, yeah, I actually took a lot of the slides from a video that I made called Oral Health in a Digital Age. And so have a look at that. It is 30 minutes long. But if this is what you're interested in, or anything else you're interested in, just email me back. And as you would have signed up, you'll get a newsletter. And have a look at the blogs on the website, because I think they're still relevant.